Thank you very much for the very nice introductions. I'm really honored to join the great publication, Air Pollution and Children Health from the beginning with Eun-CHUL from Ewha University. The question is why now the children? So children are very much susceptible to environmental chemicals and pollution, including air. The evidence is clear. Air pollution has a devastating impact on children's health. So let's see this, the map. It's a world map showing the different colors. So the green colored area is a relatively safe area, but still still 10% of children under 5 years old are exposed to the level higher than the WHO guideline. But the blue color area, that is more than 98% of children living in the place where the guideline is exceeded. So the world is kind of not harmonized very much. So this is one of our concerns. Why children are so much susceptible and vulnerable? Children are especially vulnerable during fetal development and their earliest years, while their lungs, organs, and brains are still maturing. They breathe faster than adults, taking in more air, and with it, more pollutants, of course. Children live closer to the ground, where some pollutants reach peak concentrations. The particular newborn and infant children spend most of their time indoors, where they are more susceptible to household air pollution. So you can see the picture. So this is very common in some areas of Asia and some parts of the South America and Africa as well. This is kind of a norm in their life, and they're showing how the children are exposed to household air pollution. So now we know that 7 million people died of the air pollution. And now 500,000 deaths in children under 5 years, and 50,000 deaths in children aged 5 to 15 years. But this is quite underestimated figures, even though we think that number is very high, because this number is based only on the pneumonia death from the exposure to air pollution. But we have so many findings that showing that other diseases also involved. Currently, the pneumonia is one of the diseases, but more than 50% of acute lower respiratory infection or the pneumonia in children under 5 years in low and middle income countries are due to air pollution. So that is another big the figures showing how dangerous the air pollution it is. While reviewing all the evidence and the findings from the literature showing the association with air pollution, we found that there is a compelling evidence to show the link between air pollution exposure and disease, such as adverse birth outcomes, infant mortality, lung function, acute lower respiratory infection, and pneumonia and asthma. There is also very strong suggestive findings with neurodevelopment, childhood obesity, otitis media, and childhood cancers. And also there is a suggestion to show the relation between early exposure and later health outcomes. So we need to study more, but these findings enough show that air pollution is very dangerous to children's health with many different outcomes. So now we need to make health professionals equipped with knowledge and tools. So because we believe that health professionals should play a very much critical role in the society. So health professionals should be informed well. They should recognize exposure and related health conditions. They can themselves do research and publish and disseminate knowledge to the society because they are so powerful. they can prescribe solutions and educate families and communities. And they can educate colleagues and students. Even they advocate solutions to other sectors, including policy and decision makers. So now we need to do action for addressing air pollution to protect children. The first thing is, of course, public policy. Public policy is essential. We need to prescribe public policy to protect the children. And approaches must be complementary and mutually reinforcing among the academia and civil society and particularly international organizations. I'd like to close my talk by saying that the early years, starting in pregnancy, are the best time to invest in child health. So we should do some actions to protect the children. And I'd like to appreciate all the people involved in the book, Air Pollution and Children's Health. Particularly, I'd like to thank you, Marie-Noël Brun-Dries. Actually, she planned the book and supported all the process from the beginning. And Leslie Brennan, Fiona Goldison, Amalia Labordi, Peter Sly from the WHCC, and Paige Preston, and Virginia, Julia Irene, and Elena Buca, Francesco Forestier, Tom Ruben, Sumi Mehta. They served as initial reviewers. And many others, the many authors, the editors, and the reviewers. So without their effort, we cannot make this book happen. Thank you very much.
Thank you very much, Yun-Chul. I'd now like to hand over to Beata to present on protecting children's brains from air pollution in particular. Thank you.
So there should be slides. Oh. Right. Great. So I will actually start my talk with fetal development and then go to the children's brain. And I really think it's time to act, and we can't wait anymore. I am from a Center of Occupational and Environmental Health at the University of California, Los Angeles. However, I represent the International Society for Environmental Epidemiology here. And my discipline, environmental epidemiology, is really what produces the data. And I wanted to show you a little bit about these data because this is what decision makers are usually using. And it's good to understand where we're coming from, but I also want to tell you a story. So air pollution and pregnancy is where I started. I am actually trained as a neurologist psychiatrist, so the brain is very close to my heart. And I study mostly elderly people's brains, so Parkinson's and Alzheimer's disease. So why am I talking about fetal development? Well, just like the fetus, the brain develops during pregnancy, and then the brain also keeps on developing, probably at least until we're 25 years old, and then everything goes downhill, right? Hopefully not. So we have capacity, reserve capacity in our brain for a very long time, but how our brain is set up and developed in fetal life and early childhood really determines how early our brain and how fast our brain also degenerates in older age. And so I think we need to really take a life course perspective, meaning we have this very vulnerable time early in life where the brain develops, everything sets up, the capacity of the brain is formed. We may have a child with a normal development, with a normal educational achievement. However, at the age where we are all aging and losing some of our reserve capacities, that's when it really starts showing up. So the diseases of the brain of the elderly may actually have started in early development of the fetus as well as the child. And I think we need to remember that because we have aging societies to deal with, and Alzheimer's and Parkinson's are very expensive health outcomes. And I think they start, some of them definitely start in early life. So fetal development has not been related to air pollution until this paper came out. And it is actually a California story. This was a very old map of sectors of LA, the sectors of air quality in LA, that three anthropologists from UCLA determined were more or less polluted. And then they compared in women who were non-smokers and came from the differently dirty districts in LA, compared the birth weight of these children. And lo and behold, children from mothers who were born in districts that were considered really dirty in 1973, right? When we barely had started to monitor air pollution, were weighing 314 grams on average less at birth. That's 10% of your birth weight. This is like smoking 2 packs of cigarettes a day during pregnancy. That's how our air was in LA in 1973. I think that is how the air is in many other places all over the globe right now. So, interestingly, this paper was not followed up until we came around and started in the mid-1990s to publish on air pollution in LA. And these are just, long lists, and I can give you 3, 4 more slides of papers that we published just using birth certificates and linking them to the beautiful air monitoring system that actually LA and California had developed by that time. So we had 2 amazing data sources, the vital statistics records, very simple, and the beautiful air monitoring data that was produced by the city. And because of computing abilities in the end 90s, we were able to link it, or I and my students were able to link it. And we have all these papers that came out. However, the first reviewer, a lot of these papers were actually just my work, and I'm a state employee, I have funding for my salary and my students. We did this without funding, and when I tried to get money for this, I was told, well, Dr. Ritz, you have a medical degree. Didn't you know fetuses don't breathe? They don't breathe air. Yes, I did know that. However, somehow these tiny particles that Dr. Peters showed us yesterday can go through the lung lining into your blood. They can also go through the placenta, and we know that now, right? So somehow these particles may end up in the placenta, the organ that actually nurtures the fetus, and they may end up in the fetus. And when they end up in the fetus, they can disturb every single organ system. So I went to ISEE as a young scientist and showed my results, and I'm glad to say that lots of colleagues took me up on the challenge and produced similar results all over the world. And this is just a map of where these kind of results on low birth weight, preterm birth weight differences, small for gestational age were produced. These are pooled results from one of the many what we call meta-analyses, where we throw every study that's ever been done into a model and try to estimate how much birth weight was lost due to one or the other pollutant, in this case, particulate matter 2.5, and pretty consistently birth weight, low birth weight, preterm birth, small for gestational age, all had effect, particles had an effect on it. However, all of these studies were, just like my study, based on birth certificates, and then came Europe. And Europe had these beautiful birth cohorts, right? And Europe got together, not only did they have birth cohorts, they also had wonderful monitoring data that my colleagues produced in the ESCAPE project under the leadership of Bert Bernekreff. And this data was then applied to the data in the birth cohorts. Why is that important? Because the mothers who were followed in pregnancy answered tons of questions about their behaviors and their environments, and all of the other studies were that I showed you before were pretty clear in showing air pollution effects, but we were always criticized that, well, there must be confounding. It must not be air pollution, outdoor air pollution. The mothers must must be smoking, there is, bad working conditions, whatever. And this is the study by Marie Pedersen that pooled all the data from the birth cohorts in Europe and showed, no, it's not the case. You can put in every confounder you can think of, every variable that otherwise may explain this outcome, you still see it. For particulate matter 2.5, PM absorbance, NO, traffic, you see the effect. And that's the beauty of this study, and that's the beauty of having these studies come together and being able to do what we like to do as methodologists, control for everything. But not everybody in the world can do that, right? Because these were expensive studies. Luckily, Europe did it. Well, now I want to take you to neurodevelopment and the brain of children. And I just want to talk about autism because that's the worst neurodevelopmental disorder, right? One of the worst. And we know that it is increasing, and especially in California, the rates have tenfold increased. We had 4 cases per 10,000 births registered until the early 90s. After 2008, about 100 per 10,000. And nobody was really able to explain how this happened. Some of it might be diagnoses, but not all of it. Well, we definitely know it's a bad outcome, and we definitely don't want children to have this outcome. So studies started, my colleagues started studies, I did a study in LA of autism spectrum disorders and air pollution. Again, the beautiful California data was employed. And then others in Europe followed us, and this is another of these pooled analyses that shows, yeah, there seems to be some effect, but it's not completely clear. Not all studies are on the right side of that curve showing increased risks. And overall, yeah, overall there is an effect, but we are not certain because the confidence intervals, they go over that straight line that they should stay on one side of, and they don't. So what is it about these studies that we can't really decide that autism is related to air pollution yet? Well, maybe we have looked at the wrong time period. And this is one study that was recently done in Israel with the system there, and it shows that maybe when we looked at pregnancy, we studied the wrong period. It was actually the 9 months after birth where air pollution was the worst for this outcome. And we just repeated this in Denmark. We're finding in a very clean place like Denmark with beautiful records for neurodevelopment, for autism, and amazing abilities to say where each mother lived during pregnancy because they have registers, and they can then link the air pollution at the doorstep of the mother to the mother over pregnancy periods. And we did this, and we looked at pregnancy, and we looked at 9 months after birth, and it was actually the first year of life that looked as being most important in this case. So we see a picture for autism. I showed it for LA, and we saw it in Israel, which we could consider also more polluted, but we also see it in low pollution, the signal for autism in low pollution countries such as Denmark, that has excellent health records and excellent exposure assessment. So if you ask me, we should look. And there's something. Is this enough for global burden of disease? Well, in 2010, no. Ambient air pollution, particulate matter, was considered among the 10 most important pollutants. However, based on everything except birth outcomes, everything except child's neurodevelopment or other kinds of childhood diseases, chronic diseases such as obesity that we think now might also be related to it. So what is it? What are we missing? And we thought, well, for policy, GBT is really important, and for prevention efforts, it's important. So did we something wrong by not showing good enough exposure models? No. We used all these models, and these are maps from different types of exposure models that we constructed in LA, and each and every single one shows relationships to the outcomes, birth outcomes, in this case, preterm birth. So what do we need to do? Do we need to do more studies in other places than North America and Europe? Yes, maybe we need to do that, but then we need to have exposure assessment. And I just want to advertise here the next satellite monitoring by Maya, the multi-angle imaging of aerosols that's going to go up in 2021, where we will actually have speciated particle measures worldwide, and we will be able to apply them to many, many places in the world. And we are looking still for partners for interest in different countries with health records, with birth records, but also with other kinds of health records to apply this beautiful tool. The other venue I think that we need to know more about is what are the biologic pathways, and we can study now not only animals, but we can also study humans. And we have been studying gestational hypertension and preeclampsia, which are really bad pregnancy outcomes in women that have an influence on the fetus and the fetal development, inflammation in pregnancy, and we can study now placenta function. And methylation is one way to do that. However, the US has actually started a human placenta project, which is very, very good that they are actually now considering the human placenta to be an organ to investigate, the organ that feeds the fetus for 9 months. However, the only study that actually links this to air pollution monitoring is our study in LA, and we are collecting air pollution data for 200 women from this placenta project. There are 8 more, but they are not collecting. And I'm going to skip this. So should we do more? Yes, we probably need to do more, but I think we have already a lot of data that is policy relevant and actionable, and it is not just small babies, it's organ systems that are probably not functioning properly, and even if they function properly in a healthy child, they may not last us until we age. And we should remember that. And I think prevention should be looking different than this.
Thank you so much.